Hello friends, today we'll talk about Wilcoxon signed rank test, which is a non-parametric test. Wilcoxon signed rank test is the non-parametric test which is equivalent to the parametric test or of dependent t-test. So if your data is normally distributed and you meet the assumptions, you would be applying the dependent t-test. Otherwise, if the data is not following normality or normal distribution, you will go for Wilcoxon signed rank test. As dependent t-test is also called as pre and post test analysis. Similarly, this also serves the same purpose. So let us see the assumptions of it. There are two assumptions to the test of Wilcoxon signed rank test. It is that the dependent variable should be measured at ordinal or continuous level, and your independent variable should consist of two related groups or matched pairs. So let us take an example. Suppose there is a researcher who is interested in judging the effectiveness of physiotherapy for the problem in sciatica among individuals without having to use painkillers. Sciatica is problem of back pain. The researcher thinks that having physiotherapy in the lower back might reduce sciatica pain. To investigate this, the researcher recruits 19 participants to her study. At the beginning of the study, the researcher asked the participants to rate their back pain on a scale of 1 to 10, where 1 means low level of pain and 10 means greater or high level of pain. After 4 weeks of daily physiotherapy sessions, these 19 participants were asked again to indicate their level of their back pain again on a scale of 1 to 10, where 1 was the low level of pain and 10 indicated the higher level of pains. Now the researcher wishes to understand whether the participants' pain levels changed after they had undergone the physiotherapy. Now participants are same. It is pre and post the treatment. So pre and post test analysis needs to be applied over here. Let us understand the problem in a better manner. The dependent variable in this case is the pain scores, and we would be having two pain scores before and after the treatment. How many categories of variables are there? Two. Again, before the treatment and after the treatment. And the measurement is, the scale of measurement is continuous. Now let us assume that the data is not following normal distribution. Then what would we do? We would apply Wilcoxon signed rank test. So let us apply this test in SPSS. But before that, what would be the null hypothesis? The null hypothesis in this case would be that there is no statistically significant difference in the pain score, that is before and after the treatment. The pain what is felt by the participants is same, and alternate would be that there is a statistically significant difference amongst the pain scores as indicated by the 19 participants. So let us apply this test and see what kind of results do we find. In SPSS, I have defined two variables. One is before, the pain score as given by 19 participants before the physiotherapy treatment, and after the physiotherapy treatment is the second variable. And I have pointed in some dummy data. So based on it, in order to apply our non-parametric test, I need to go to analyze, move to the test non-parametric test options, and over here to legacy dialogues. As we are talking about two related samples, so I would be choosing the test of two related samples. I'll select that. Now over here I would select this before and would press this arrow button. It would go into the test pairs variable 1, and my second variable after, again I'll select like this and I'll click this arrow button again. It will go under the variable 2. By default, test type is Wilcoxon over here. In order to get descriptive data, I need to click on options, and under statistics I'll choose descriptive. Click continue over here and OK. You would be finding in total 3 tables over here. One is the descriptive statistics, one is the Wilcoxon signed rank test, and third is the test statistics. So let us discuss these one by one. First of all, I would look at the test statistics. Over here My p value is 0.000, which is definitely less than 0.05. So rule of thumb is, if p is low, h naught must go. So in our case, null hypothesis is rejected, which means that there is a difference in the pain score as told by participants before and after the physiotherapy treatment. Now, I would look at this table of Wilcoxon signed rank tests. Over here, you would find there is negative ranks, positive ranks, and ties. Now, what do you mean by negative ranks? You would find the n is 17 in case of negative ranks, and there is this superset A given over here. This A simply means that after is less than before. It simply means, see, what was our scale? It was on a scale of 1 to 10, where the lower number means less level of pain, and a higher number, like if you are moving towards 1, it means the pain is less. If you are going towards 10, means pain is more. 7 out of 19, 17 patients were those who said that after the treatment, their pain scores are on the lower side. Means the treatment was effective in almost all of the cases. 19 were total, 17 said the pain has reduced. And there were two ties, means two of the patients said that they are not able to feel any difference, but nobody said that their pain level has increased after the treatment. So this treatment is effective. So how we would put the results? So a Wilcoxon signed rank test showed that a 4-week daily physiotherapy treatment course had elicited a statistically significant change in sciatica pain in individuals with existing lower back pain. Z score this, p value this. So the physiotherapy treatment course in sciatica pain is effective. So I believe you would find this demonstration easy to understand. Wilcoxon signed rank test. Thank you so much.